Thank you for joining us today. I'm your host, Tracy Bennett. In studio with me are certified financial planners Tyler Cook and Tody Payne. Good to see you guys back at it.
Good
today.
To be with you.
We're going to hit a conversation I think that's really relevant in a lot of people's lives. When you've got a parent who is declining in health and you need to start making care decisions and financial decisions for them on the fly. I myself went through this at least once. So looking forward to the conversation. And, people quietly deal with this. This is not something, it kind of sneaks up on a family. You think you're prepared for something like this, and then you're in it and you're thinking, oh my God, it's just, there's something very different about caring for an elder versus caring for children. It's just it's a privilege, and it's such a huge responsibility. So you need to make sure you've got everything aligned properly. Do you want to say anything before we go into the bullet points?
Just a topic. This is something we focused on for many years. I think just with baby boom generations getting older and we're kind of seeing more frequencies of these things, we've deliberately set out a certain quarter of the year where we focus on this. We call it dependent planning. When you hear that, people might think it's for their children, but it's really both sides to what you said. It's your kids and possibly your parents or grandparents that you're helping out. So it's a huge financial planning topic that needs more attention.
Mm-hmm.
More in our industry, you hear about it as this great wealth transfer. And so many firms talk about, how's your trust set up or leave a legacy and money. And it's all about the money. And what we found is there's so much more than that. And there's so many ins and outs. And that's what we want to focus on today. Mm-hmm. The trust aspects, the legacy planning, estate planning. Mm-hmm. We'll touch on that a little bit, but that's not the focus here. Mm-hmm. There's the human side of you've got to go to work. You might have kids. You're taking care of an elder. You've got all these decisions to make, how to navigate that. And especially if health turns or if they're having a diminished capacity, you know what? That's what we're getting into today.
It's sometimes the emotional aspect of can immobilize you, so you do nothing, and we don't want you to do that. So let's talk about when the health changes overnight. So when I want to kind of highlight a review about legal authority, who can make decisions and so forth. So if you could address that.
Yeah,
and we're not attorneys. Should say that, right?
You get that, yeah. Thank you. You get that one out of the way.
Yeah,
We'll say that a couple times.
I know you
No, definitely
he's
not.
as close to one as I've ever known.
I did not stay at a Holiday Inn Express.
Yeah. He probably missed his.
None of the above.
He probably should have gone to law school.
Yeah, but to say this though, there is a plan if you have nothing, and it's called the state. The state will administer things for you, whether it's guardian, administration, decision-making, which I can't help but paint the picture. That's not who you want in charge.
Yeah.
You do not want the defaults to just go in, or worse yet, someone who you'd want to be making decisions unable to do so. You know what? Maybe that spouse already has a diminished capacity, or they had to go through it with a parent and make some decisions on their own that they don't want to do that. Mm-hmm. But the hospital's looking at them going, hey, you're next. What's up? Mm-hmm. And that's what we really want to try to avoid. And when you think about it from the legal aspect, I think I shared this with you, Tyler. I printed off all these copies of the Ohio has a packet basically for living will, healthcare power of attorney, whether you want to be a donor, appointed guardian, release healthcare records. It's really neat. It's
nice.
It's a really intensive packet that they put out there. So I had the elders in the family. My grandma, my dad, my dad's wife, all of us were there, my wife and I, and we just passed them around to say, does everybody have this? If not, fill it out. We'll go page by page together. But the idea of, if we did have that sudden decline, somebody, we get the call in the middle of the night, somebody's being life-flighted somewhere, I got to be there. Well, do I have the authority to make decisions? And it's those documents, having those all done ahead of time while people are healthy, have their wits about them, there's no urgency. That's the first starting point in all this.
And that's a free packet.
Yeah.
Right?
Yeah,
no cost.
Yeah.
No cost.
The caveat to that, and I just actually went through this with a relative who used one of those packets and assigned me as their executrix.
Yeah, you're on it. Yeah.
There at the end,
Their power of attorney, all that good stuff.
Yeah.
But they didn't have it notarized. So probate stepped in and said, sorry. Now I ended up I was appointed the administrator, but it took about 6 or 7 months for that to happen.
Oh.
Yeah.
And see, this is
and
where,
we're still, a year later, we're still we're still going
Ah.
through the estate because there was no estate planning.
And-
So get it notarized
Well,
immediately.
and on that point that we're not attorneys, reading that, the Ohio form at least, it says if you get two witnesses not listed in here, you don't have to get it notarized. So that was the
See?
missing piece
Attorney,
in that.
right?
Yeah.
Well,
little
I'm
fine
saying
print.
That's good to
and,
know.
And it has been updated, so I don't know your situation, but
Yeah.
the idea of when you print that form out, reading it, going through it page by page. I'm watching my dad. He's trying to flip ahead a page. I'm going, Dad, did you initial that? He didn't. We went back and got it.
like,
But
"No, I trust
the
you."
idea of you don't have to make it as complicated, because I know in some situations just getting to the bank, getting a notary, roadblock, not going to do it. So that's why I want to address that
Yeah, that's
doing
good
it
to
the
know.
right way, they've got to be witness. At least in Ohio, they had to be witnesses not listed in the plan.
Mm-hmm.
So to have neighbors over, which we did, to be able to say, hey, you're here, and we could have a full signing ceremony, get it done for everybody.
Smart.
That way, that quirk didn't come into play.
Fantastic. What a gift to
Well-
them. That's awesome that you did that.
I did get Christmas presents too, but it was good. It was
good to have
I think, well,
around.
but also I think not selfishly, but it gives you some peace of mind.
Oh,
right?
selfishly.
Selfishly,
Oh,
okay, all right, all right.
definitely. I mean, I've shared here before, but we went through it with a passing last year where those documents came up so often. You think about somebody was at one facility, they went somewhere else, let's say it's the hospital from a nursing home. How do we get the records from the nursing home? Who can release those? That's all legal. That's all HIPAA. So to have that stuff covered and be able to say, we've got that.
Yeah, and they won't
Call
even
them,
talk
give them
to
the
you.
records,
They
right?
won't even talk to you if you call them to ask the status of somebody.
And
So,
that's,
yeah.
again, we're having the documents allows that, and they will. They can't say no because then you're that person. So
Excellent.
all these horror stories kind of go away when the documents are there. And like you said, they're effective.
Yeah. Okay. So we've gone through the legal authority, making the assisted living decision under pressure.
Yeah.
Again, something sadly I've experienced, and I know somebody who's going through it now. Focusing on evaluating the care options. When you've got somebody coming to you that's in this situation, what's the first thing you tell them?
If they're already in the situation, I empathize with you, first of all. I mean, that's a lot. It's so much. I mean, it affects your health, your mental health, your finances. I mean, it's a lot to be a caretaker. So to acknowledge that right off, that if you're feeling overwhelmed and there's a lot going on, that's the way it is in a lot of ways. So that's why getting professional help, being able to navigate this with somebody. I mean, even a financial planner isn't the end all be all here. There can be a professional guardian, professional caretakers, somebody that can help make sure you picked up that script, make sure that the pillbox gets updated. So again, the financial piece is one element of it, but if you're in that scenario taking care of somebody, you want to look for help, I think.
How do you address the cost structures? I mean, I think you're meeting with the director of the facility. I mean, my experience was to vet 4 or 5 locations or communities, and then I also had access to some information where the nursing facilities are governed by the state. So there's actually a grade card, a report card that is put out about the level of care in each facility. Where they're good, where they're not, where they have weaknesses.
And we're pretty lucky in that because that's state of Ohio specific. The Department of Aging did that. So depending upon your state, it may be your Department of Aging to go to say, hey, what's the scorecard here? What's
Right.
your record? So these are great points.
Yeah. Okay, turning the family home into a resource. Where does somebody even start if they need to sell their parents' house to pay for care? Assuming that somebody has had to put their parent in an assisted living facility, they have power of attorney, they have all of the documents in place. Where do they start?
Well, I'm going to go back. I answered the question about, what if they come in and it's already happened? You know what, you're in that scenario already, but not in a perfect world, but in a perfect world, you've done your homework ahead of time. You know what, we're aging together. Maybe we don't have, my wife and I, we're childless. We don't have children, so who's going to take care of us? Being mindful of that, discussing, looking ahead and saying, you know what, hopefully we can just age at home and die in bed one day and that's great. Or on the golf course. That's where I'd like to go. But if that's not the case, which for most people or a lot of people it isn't, you know what, have we interviewed who's in town? Do we know where we don't want to go? It seems like a lot to say, why am I going to interview this place if it's never going to come into play? But when it comes into play, you may be stuck at, well, who has the next available bed? who's got the next available opening. So if you already have a relationship with a rehab facility, maybe you've interviewed there, they already have your paperwork, it's not to say that you're always committed to this, but they know your name, you know who's there. It's a little bit easier if something were to come up to say, here's where we may transition, as a plan B even.
And you're seeing too here across the country, but a lot here in Central Ohio, these new continuing care retirement communities, they call them CCRCs, where people are consciously thinking of this issue later, happening later, and now, while they're still healthy, going into these communities, living independently, and they age in place. And as the level of care increases, of course, their costs do, but it's all right there on site. And there's tons of these going up across the country. But a lot of the theme I've seen just recently, the last couple of years, is people shelling out a lot of money just for the certainty, though, to know that they're not going to be a burden to the family, or if there are no kids in scenario, they're eliminating who's going to take care of us. They're being proactive with it. Now that comes at, again, like I said, a hefty price tag. You're talking hundreds of thousands of dollars to get in the door, and then you have monthly costs on top of that. But for those who have saved and have done well for themselves, that's an option. But I feel like the other part too, like you said, Tracy, it's you don't know until you're going to get out there and interview 4 or 5 different places and go in person and see what it's like. But that only takes you so far too. So it is kind of a leap of faith, I feel like, until you actually have your loved one in there and you kind of see how it plays out.
And like you're saying, Tyler, to go in there when they have the glossy and it's like a campus visit's one thing, but to go in on Sunday afternoon when there's, the other staff there, they're not expecting you, how is it treated that day? How am I treated that day? I think is also really important. So the idea of, to go out and feel these places out, whether they're relevant or not for you. Sometimes it's a very positive experience because if you're used to, I can't help but think of the old days where do anything to keep me out of there. Do anything, keep me at home. And that's where some of that burden and caretaking on the family comes in. If you go into a facility now and wait, there's a Tuesday night cocktail hour? What are we doing here? This sounds great.
Yeah.
You actually get to live, socialize a little, and if or when a healthcare event comes, you're already there. You already have a network around you. You're not just building your life around the kids visiting on Wednesday when the kids don't have practice. You might have your own life going, which is important.
There's one in town here I visited, had an Irish pub, and I was like, this sign me up. This is a good one. This is a great spot.
I know somebody who was in one that was catered by Cameron Mitchell every night.
Oh,
right, a fancy caterer.
Place to be.
Not cheap.
Yeah, right. But there are the great points made. I'm the lay, so I can't address the financial planning side of it. But there are so many layers. My experience says when you start to see a little bit of a glimmer of change, start doing your homework. Don't wait until the last moment and ask the questions. Is there a physician on staff full time? What happens if there's, if my elder experiences a UTI, do you take them off campus or do you test it on site? Is there nursing 24 hours? Is there a physician's assistant or a doctor? I mean, there's so many things that are outside of this that you don't know until you know.
Well,
until you're there.
And maybe not a horror story, but something to be mindful of. And it could be a horror story. Depending upon the condition and how things are set up, they may be responsible for your health. So you think about, well, it's Christmas. I want to be with the family. Well, if they're responsible for your health and you're really dealing with it, maybe they have to send a care person out with you. Maybe they have to send you out in an ambulance. That's not usually free. If they give you the option to visit family, you're usually paying for that. So asking these questions, you know what, if I were to go there, and I'm okay going there, I enjoy the pub, I enjoy the social environment, but you know what happens when I want to go visit my family? Ask that ahead of time.
And does insurance cover it?
Right, and you'll get different answers. Right, exactly.
So it's out of pocket, ancillary. It's considered ancillary, so it's out of pocket.
Yeah, the old optional, and again, part of planning where if you have the resources, and maybe plan A was you're going to golf every day and live at the beach and things are great, but if plan B happened and your health changes, well, hopefully those funds that were for golf, you could use those for some of this extra care.
Yeah, and you were talking, well, we've been focused on the community aspect of going to a facility, but typically what you'll see too is you can bring in somebody to the home at an hourly rate, and there's different rates based upon the type of person coming in. To your point, is it an RN or is it just somebody who's like a nurse's aide? Different costs, different hourly costs. I saw this with my family, and they were able to have somebody come in around the clock. And my grandmother lived till 99 at home. It was wonderful, and they were able to do that small town USA, and it wasn't breaking the bank. But that versus like New York City or somewhere else, right? You're going to pay different costs, but on average, and you can look this all up too. But assisted living is kind of that first level into a facility. And then when you get full blown, long-term care nursing home coverage, that's when it can easily be $10,000, $20,000 a month based upon your area. Mm-hmm. So it's
and it ticks up very quickly.
Correct.
You start out, they bring you in at the bottom. Oh, it's only this, and then within 6 months, because it's a business, they're making money, so they're looking for any element of need that they can tick your relative up to the next tier. So being aware of that and having the money set aside is good.
I can't. Oh, good.
No, I just thought of a story I saw years ago. This is a true story. Reviewing some expenses, looking at cash flow like we always do, and noticed on one of the statements, working with one of the spouse or the children of the person at the time, there was a unusual fee that started showing up on the invoices. Long story short, it turned out to be a bad employee at one of these buildings was adding fees to basically the residents' invoices, and they called this one was a cat fee. I knew you're a cat person.
A cat fee.
$500 a month cat fee. And because we talked about aging for your parents, because the child was involved watching this, she caught it. Did a great job. And anyway, it turned into a whole issue, and it was not just her. It was the person was doing this across the whole business, so the whole facility, and obviously they got canned and fired and lawsuits and all sorts of stuff. But if you're taking care of a parent, it's not just the day-to-day stuff of the healthcare, but make sure you're getting copies of the invoices, reviewing charges. To your point,
pay attention.
If they're going to bump you up another level of care, make sure you know why. You got to. That's what you can do as the child of the person who's in the facility, is being their advocate in that sense of not just everything's fine, they're in that facility, but really take a look and review, and just like we would tell somebody with their own plan.
Well, the idea too of you don't have that time, because that could be real too. You've got your child, your career, your spouse, your life. So we're in a sandwich generation with a lot of people where they may be taking care of parents and elders and maybe even grandparents, like you said earlier. So the idea of, how can I focus on this? How do I boil it down to say, I got to take care of me first. And that's really important. So I can't help but say that as we go through, and there's all these things pulling at you, because again, being that caretaker, you're usually the one who sacrifices. You're usually the one that skips an appointment, or you're not taking care of yourself there. And that's where sometimes that spiral comes in that we can see, where you've got that one person who had a rapid health decline, and then the other person sadly goes along with them.
Yeah, definitely good advice. All right, I want to redirect back to turning the family home into a resource. Is there a methodology to this, or what would you tell a client who is experiencing this that they should what should be on the radar?
Well, first question is, do you actually need to sell the house? If the answer is yes, kind of go through the process, because there's a lot of times too, people want to have a home to pass on to the next generation, or if there's multiple siblings. It's just the whole thing to talk through as far as a family is concerned. But the first question would be, do you actually need to sell it? That's the first question. So I think from the analysis standpoint, you have to look at what the new monthly cost would be for a facility. Can you afford to maintain the house with basically nobody living in it? That also, by the way, that changes insurance premiums and all sorts of stuff when you have unoccupied homes. So there's a lot of costs involved. And it goes back to the basics of planning. Look at the cash flow. Can you afford it? Is there money left over every month? If the answer is yes, then you have some time to make a decision. But if it's that fire sale scenario, you're kind of stuck. And
So
probably
it
take the
boils
best
down
offer.
to whether or not your loved one needs the money for their care.
Yeah, absolutely.
Yeah. Again, think about the emotions, though. I mean, you've had a parent, maybe dad's already passed on, and it's mom who's lived in the family home. She fell, something happened. They've said, hey, we don't know what it looks like, but the house is just giant. There's no way that's the right house for mom. Do you sell it and make some decisions? Do you have that discussion? This is where, again, hopefully early on you've had that discussion with the family all together, where suffocating logic can come. Mom, when you're in your 90s, are you really going to be shoveling the snow out here when dad's sitting in the chair? Are you doing this? And to have that discussion, paint the picture, is when I think then the reality starts to hit. And people don't like to think about getting older. They don't like to think about slowing down.
It's not fun.
I live this every day, and it's hard for me to have these conversations with my kids. It's very easy to sit and say, have the conversation, and then I turn around and I go home. They bring it up. I'm like,
Well, I'll spoil it though. You're lucky. You've got good kids. You did that.
Yeah, and
it's hard.
I think going back to this house sale conversation too, I would hope, to the point about being proactive, that somebody's the decision maker already. so that you're trying to prevent infighting among siblings if you have that scenario. But
Yeah.
somebody can make the call. You need somebody to have an authority to say, all right, this is what we're doing.
Yeah. Okay. This one, I just want to read it because I want you to hear it exactly the way it's stated. So, creating a care-focused cash flow plan. Discuss building a flexible spending plan that adapts to changing care needs, prioritizing liquidity and coordinating withdrawals, and the broader investment strategy.
It comes down to
Say that in
having,
my language.
Yeah.
when you are saving all your working life, saving in different buckets, saving in different ways, without getting in all the tax codes and implications, each bucket, each letter soup, IRA, Roth IRA, 401k, brokerage account, each of those has a little different flavor later in life when you go to take money out. So if you have flexibility because you have a little bit of each of those, usually that can give you that, like Tyler mentioned earlier, a health savings account, an HSA. That may be one bucket to pay a care person. There may be another bucket to say, you know what, I need to pay landscaping. That's not a qualified expense, but I can pay that out of this. Those are the kind
And
of
we're talking about your parents' accounts.
maybe your own, maybe your parents, depending upon how far ahead you're planning. Because if you're thinking for your own retirement, your own aging later, that's where if you have these diverse buckets, knowing which one to tap and why. But then if you're helping your parents out, getting the full picture, what do they have? If they have an advisor, talk to them. And that again comes back to, do you have the legal permissions that their advisor is going to say, sorry, can't talk to you, but yes, I've got to treat you just like you were mom or dad and answer your questions. That's where this idea of how do you structure it, how do you do it the best way, you've got to unlock things first, know what's out there.
So that's if your elder doesn't have the money for their own care, I would assume. But what if they do and they have their own financial accounts? Does the same concept apply?
Very similar, and I may have conflated things there, but if they already have their accounts, you need the legal permissions to talk to their advisors. You know what? Mom's property tax is paid automatically out of this account. If something happens to mom, can I make sure it's still paid? Does the account get frozen? These are the kinds of questions to ask. If they've got all their finances in order, life is grand, you still need to know what happens if. And again, the idea of paying for care and coordinating that, there might be the home health care person that's helping out with meals and healthcare stuff. You might also pay a care coordinator, somebody who's maybe more the administrator of things. There's different levels here. So when you know what do we need, then you can start to go back to your buckets. Which one's best for this expense?
That's where we can help coach students talk about, okay, if we take it from this account, it's going to be taxable this way. This account will be another way. But again, it's a little different when you're dealing with somebody's parents versus their direct plan. And that's to your point. You have to have the transparency. Again, it's just basic stuff. Just having those proactive meetings, knowing where the money is, where you're going to pull from it. You got to talk about it before the situation happens.
Yeah, it's almost like you're telepathic. That was the last point I was going to bring up. So you just answered it. Fantastic.
Excellent.
Well, this is a behemoth, something that we could go on, I think, quite a bit with. So we hope you'll consult the specialists. Give us a call if you'd like. We're glad you tuned in. Thanks for joining us. Like, share, and subscribe.
Boxland Media. Think big.